In traditional Chinese medicine, we often emphasize one simple principle: stay warm. Avoid excessive cold food and cold drinks. Protect your yang qi. This is especially important for patients with chronic rhinitis, chronic diarrhea, irritable bowel symptoms, recurrent mucosal inflammation. Many people ask, why is warmth so important? Is this just traditional belief? Today, I want to explain the reasoning behind this. First, from the TCM perspective, and then from modern physiology. In TCM, we say the nose and the intestines are closely related to yang qi. Yang qi represents the body's functional warmth and dynamic activity. When yang qi is sufficient, circulation is smooth, the body maintains internal warmth, digestion functions properly, mucosal tissues repair efficiently. When yang qi is deficient, the person feels cold easily, nasal congestion recurs, chronic diarrhea persists, fatigue appears. In classical texts, cold is described as something that constricts, slows movement, weakens transformation and transportation. In modern language, we might say cold reduces functional efficiency. TCM summarizes this entire physiological state into one concept, yang qi. Now let's look at how modern physiology might describe the same phenomenon. Enzymes and temperature. All enzymes in the body function within an optimal temperature range. For most metabolic processes, that temperature is close to 37 degrees Celsius. When local tissue temperature decreases, enzyme catalytic efficiency decreases, metabolic reactions, slow tissue repair becomes less efficient, anti-inflammatory processes become less coordinated. This does not mean enzymes stop working. It means the system becomes less efficient. Cold and chronic rhinitis. The nasal mucosa is extremely sensitive to temperature. When exposed to cold air, cold receptors such as T, R, P, IM, 8 activate. Sensory nerves release neuropeptides, blood vessels dilate, mucus production increases. This is known as cold-induced neurogenic inflammation. The intestines are also temperature sensitive. Cold exposure can reduce local blood flow, alter intestinal motility, reduce digestive enzyme secretion, decrease mucosal immune efficiency. In healthy individuals, this is temporary. In people with chronic digestive weakness, this may destabilize regulation. From modern physiology, we talk about enzyme activity, neural pathways, microcirculation, immune regulation. From TCM, we describe the same functional state as yang qi. Yang qi can be understood as the integrated functional vitality of the body. When yang qi is strong, regulation is stable, repair is efficient, inflammation resolves more easily. When yang qi is weak, sensitivity to cold increases, mucosal inflammation becomes recurrent, different terminology, same body. This does not mean everyone must avoid cold food completely. It means if you have chronic mucosal inflammation, whether in the nose or the gut, maintaining warmth may support regulatory stability. Warmth supports efficiency, and efficiency supports recovery. Traditional Chinese medicine emphasizes warmth because warmth supports functional regulation. Modern physiology explains how temperature influences enzyme activity, circulation, and immune coordination. 2 languages, 1 physiology.